All right, let's jump right in. In the world of the ICU, there are a handful of medications that are just essential, absolute staples. And today, we're talking about maybe the most notable one of them all, Propofol. If you've spent any time in critical care, you know this one.
You've probably heard its nickname, Milk of Amnesia. Kind of strange, right? So what is this stuff really? How does something called milk of amnesia become such a cornerstone of modern medicine? Well, that's exactly what we're going to unpack today.
So, first things first, what exactly is Propofol? I mean, it's an incredible tool when it's used the right way, and this is a big but, it also comes with some really serious risks.
Okay, so the textbook definition, Propofol, you might also hear it called Diprivan, is technically a hypnotic or sedative agent. Its main job is pretty straightforward but incredibly powerful. It dials down a patient's consciousness and, this is key, it causes amnesia. That way, they don't have to remember any of the painful or scary stuff they're going through.
And this right here is a super important point, maybe one of the biggest misconceptions about it. Propofol is for sedation, not for pain. So even though a patient might look totally knocked out and peaceful, they could still feel pain. The drug itself does absolutely nothing for pain relief. You have to give other meds for that.
So you're probably wondering, how does it actually work? And the funny thing is, we're not 100% sure. Seriously. Like with a lot of anesthetics, the exact mechanism is still a bit of a mystery. The best theory we have is that it targets our GABA receptors. Think of these as the off switches in your brain. Propofol seems to just supercharge them, telling the brain to slow way, way down. So yeah, we know that it works, just not the nitty-gritty of how it works.
Okay, so we know what it is, but why is it the go-to sedative in pretty much every ICU on the planet? Well, it all comes down to one thing, its biggest advantage. It is incredibly fast. I mean, just look at this. It starts working in under a minute. And once you stop the infusion, the effects are gone in about 5 to 10 minutes. That means patients wake up fast and they wake up clear. None of that long, groggy hangover you get with other sedatives.
And why is that so important? Think about a patient with a serious brain injury. The medical team needs to do neurological checks all the time to see what's going on in there. With Propofol, they can just turn off the drip, wake the patient up for a few minutes, do their exam, and then put them right back under. With older, longer-acting drugs, that was just impossible. This is a total game changer for critical care.
Okay, but here's where we get to the other side of the coin. For all of its amazing benefits, this is a seriously powerful drug, and with that power comes some pretty significant risks that you have to watch like a hawk.
The biggest ones we worry about are hemodynamic, meaning what it does to your heart and blood vessels. It can cause a really sharp drop in blood pressure. That's hypotension. And it can also slow the heart rate way down, which is called bradycardia. On top of that, it suppresses your natural drive to breathe. That's why pretty much any patient on a continuous Propofol drip will have a breathing tube and be on a ventilator.
And we're not talking about a small dip in blood pressure either. It can drop by 30% or even more. It basically chills out your sympathetic nervous system. That's the fight or flight system that keeps your blood vessels tight and your pressure up. It's a huge effect, and it's why you have to be monitoring these patients constantly.
All right, so we've got the good and the bad. So where do we actually use this stuff in the ICU? It really boils down to 4 key situations.
First up, for intubation, it's what they often use to put you under right before the breathing tube goes in. The second, and probably the most common use, is for keeping patients sedated while they're on a ventilator. Third, it's great for quick procedures right at the bedside, like shocking a heart back into rhythm. And finally, number 4, it's a powerful tool used to stop seizures that just won't quit, a really dangerous condition called status epilepticus.
Now, given how potent this drug is and all the risks we've talked about, it should come as no surprise that you can't just hang a bag of it and walk away. There are some really strict, meticulous rules you have to follow. Remember that milk of amnesia nickname? Well, it looks milky because it's in a lipid or fat solution. And here's the catch. That fatty base is the perfect place for bacteria to grow. So you have to use an absolutely strict, sterile technique. The IV lines have to be changed every 12 hours, way more often than for most other IV meds. And since you're literally pumping fat into someone's veins, you have to keep a close eye on their triglyceride levels.
And that fat base leads us to the scariest complication of all. It's called Propofol infusion syndrome, or PRIS for short. Now, thankfully, it's rare, but when it happens, it's often deadly, and it's triggered by giving high doses of Propofol for a long period of time.
When PRS hits,
the body's entire system just goes haywire. We're talking severe acidosis, where the blood becomes acidic, potassium levels that shoot through the roof, and the muscles start breaking down. It's a cascade that can lead straight to catastrophic heart and kidney failure. And this is exactly why doctors are so careful about using high doses and always for the shortest amount of time they possibly can.
So when you step back and look at it, Propofol is the absolute definition of a double-edged sword. On one hand, it's this indispensable, life-saving medication that gives doctors a level of control that's just unmatched. But on the other hand, its power demands just immense respect. It requires constant vigilance and a whole lot of expertise. It's a tightrope walk between profound sedation and patient safety, and it's a walk that critical care teams make every single day.